Number 1. Influenza/flu. Someday, you wake up with a scratchy throat and a pounding headache as if you strike a wall. That's probably flu or influenza, a viral infection that has attacked your nose, throat, and lungs. This seasonal infection is the most common from December to February. The symptoms appear within 2 to 3 days after you catch the infection. Flu has different types like A, B, C, and D. Among all types, type A is the most dangerous. It can develop into pneumonia, leading to hospital stays and even death. Every year, in the US alone, between 9 to 41 million people catch influenza. At the same time, 700,000 people die from the flu globally. The good news is that the flu isn't picky. However, if you have a weak immune system or chronic health conditions, you're at risk. Don't worry. You can fight the infection by resting, getting more fluids, and opting for over-the-counter meds can help. But if the symptoms don't get better, go to your doctor, who might prescribe antiviral drugs. Proactively, it's best to get vaccinated. Wash your hands often as sneaky viruses crawl on all surfaces from your door handles to kitchen counters. Cover your mouth when you cough, and avoid close contact with sick people. Surprising fact, flu shares almost all symptoms with COVID-19. Number 2. Upper respiratory tract infection. Common cold. Did you ever have a runny or stuffy nose, an irritated throat, a heavy head, and a hot body, but everything got better in a few days? That can be the common cold, an uninvited guest who might visit you about 2 to 4 times yearly. Several viruses cause the common cold, but rhinovirus is almost half the troublemaker. Luckily, your immune system has the best power to fight the common cold. It can make the infection leave your body in just 7 to 10 days. However, people with weak immunity may face more severity. If you get a cold, rest, drink lots of fluids, and use over-the-counter medicines to ease the symptoms. Remember, avoiding the common cold is tricky but doable by maintaining hygiene and maintaining distance while meeting sick people. Now, how does the cold differ from the flu? The cold hugs you with milder symptoms that soon disappear, compared to the flu. Number 3. Pneumonia. Your lungs are like sponges with little sacs, made to soak up air with each breath. But what if those sacs get inflamed, and some fluid or pus blocks them? Breathing will be hell. That's when you get pneumonia. It's a serious lung infection that is the 8th biggest death cause in the USA. Streptococcus pneumonia, Staphylococcus aureus, Mycoplasma pneumonia, Legionella, and chlamydia cause bacterial pneumonia. The influenza virus causes viral pneumonia. Don't overlook early symptoms like chills, chest pain, shortness of breath, and fever. It majorly hits children under 5, adults over 65, and people with underlying health problems. So, if you have trouble breathing, rush to your doctor as soon as possible. They'll test you for pneumonia by taking a blood test, chest X-ray, or CT scan. Depending on the cause, they may use antibiotics or antivirals to treat the infection. Remember, pneumonia is no joke. So it's best to get a flu and a pneumococcal vaccine if you're over 65 or have ongoing health issues. Number 4. Pharyngitis/tonsillitis. No stuffy or runny nose, but sandpaper-like scratchy throat can also be sometimes extremely annoying, which your doctor may call pharyngitis or tonsillitis. It's an infection that makes your back throat sore and swollen. Pharyngitis inflames the pharynx inflammation, while tonsillitis affects your tonsils, 2 lumps of tissue on either side of the throat. Flu viruses or streptococcus bacteria can be the key player behind strep throat. This minor infection is so common that it affects everybody at some stage, particularly in childhood. As a temporary solution, over-the-counter pain relievers may also help you. But if your throat irritation isn't easy, go to your doctor. They may take a test for these infections by swabbing the throat and checking for bacteria. Then, they may choose antibiotics or antivirals according to their findings. Number 5. Urine tract infection. Have you ever had a burning or stinging feeling when you go to pee again and again? Maybe you saw some cloudy or bloody fluid as well. That may be the lower urinary tract infection or UTIs. Because of bladder inflammation, notorious bacteria known as Escherichia coli, E. coli, cause this infection. Unfortunately, this inflammation sometimes travels beyond the bladder and affects kidney function by causing inflammation. That deadly severity is known as pyelonephritis. If not checked timely, pyelonephritis can even result in acute kidney failure, fluid buildup in the lungs, and diastolic heart failure, leading to death. Besides affecting millions of people from all genders, the infection affects about 30% to 50% of women overall. If your UTI doesn't go with preventive measures, go to your health expert. They may deal with the bad boy with the help of antibiotics. If you have ever faced a UTI issue, make sure you drink lots of fluids, urinate whenever nature calls you, and wipe from front to back after using the bathroom. Number 6. Gastro-enteritis. Can you imagine having a half-dozen morning trips to the bathroom following last night's big dinner? That can happen when your digestive system is inflamed. Why? That's because some nasty virus or bacteria got a chance to creep into your mouth, maybe from undercooked food or a dirty surface. The condition is known as gastroenteritis. You can also call it stomach flu or food poisoning. The infection is so occurring that it affects millions of people each year. In the United States alone, 179 million people suffer from it yearly, almost half the population. Viruses like norovirus make up around 60% of all cases. Bacteria like Salmonella and E. coli are responsible for many cases of food poisoning. Don't worry, gastroenteritis isn't that serious mostly, but it can drain your fluids and worsen the condition. So you must see your doctor if your diarrhea doesn't improve, you have dehydration, or you see any blood in the stool. They may prescribe you antibiotics or antivirals, resting and drinking plenty of fluids after checking you. As a precaution, always wash your hands before eating food or touching your face, and only eat properly cooked fresh food. Number 7. Cellulitis/erysipelas. Can you imagine awakening someday with some redness on your legs and feet that feels hot? That could be cellulitis. Your skin is like a protective cover. But sometimes, some bacteria can have a chance to enter your skin through some tiny crack or puncture, perhaps through a bug bite. After entering, they cause inflammation, sunburn like redness and pain. These symptoms may even worsen if not treated promptly. For example, cellulitis can cause severe tissue damage, gangrene, limb loss, damage to internal organs, and widening of veins, leading to low blood pressure and even death. The infection seems everywhere. It affects almost 14 million people in the USA yearly. Cellulitis has many forms, milder or severe. Among these, erysipelas is a milder and less common skin infection caused by Streptococcus pyogenes bacterium, limited to only the upper layer of your skin. It has a more prominent, raised, and shiny appearance, while cellulitis has a less defined appearance with a darker color. Similarly, cellulitis digs deeper into your skin. That's why people with weaker immunity and long-standing health conditions like diabetes may face possible complications. So, keeping the seriousness of cellulitis in view, it's a wise decision to go to your doctor as soon as possible. They can determine the infection type and nip the evil in the bud by prescribing antibiotics. It's best to keep your skin clean, cover up cuts and scrapes, and care for any underlying health issues to prevent such infections. Number 8. Hepatitis. As a busy factory, your liver can sometimes stop working correctly. It's because some virus known as hepatitis causes inflammation. This common liver infection has 5 major types: A, B, C, D, and E. Some of these are less dangerous while others can be life-threatening. For example, hepatitis A and E can come from polluted food or water. But hepatitis B, C, and D usually reach your body through infected blood or fluids. Among all types, hepatitis A with yellow fever is the least serious. It goes away within 6 months without causing much damage to your liver. However, other types, especially B and C, cause long-term effects, which may result in liver scars and even liver cancer. This might surprise you that hepatitis C alone affects about 1 million people worldwide. Your body may show symptoms after a few weeks or months when the virus attacks the liver. These symptoms can be fever, tiredness, less hunger, nausea and vomiting, abdominal pain, dark urine, pale stool, and joint pain. However, the severity of symptoms depends on the overall damage that the virus does to your liver. If you fear you've got hepatitis, your doctor can rule out it with blood tests, but we'll advise you to get yourself vaccinated for hepatitis B and D to keep the devil away. Sadly, there's no shot for hepatitis C. So, proper hygiene and a healthy lifestyle are your lifesavers. Plus, you should also stay away from bad habits like drinking. Number 9. HIV. Can you imagine fighting with a whole army but unarmed? That's what HIV as a thief does to your body by stealing its entire defense system, what you call the immune system. So, what happens? You become weak and fall prey to several diseases. This situation is called AIDS. HIV infection has infected 38 million of the world's population. Among its types, HIV-1 is the most common type, while HIV-2 is found mostly in West Africa. Contact with an infected person's bodily fluids like breast milk, semen, vaginal fluid, or blood can spread it. By unsafe sex, sharing your needles or razors, or getting blood from an infected person's blood, you can get this infection from the sufferer. If bad luck happens, the doctor can test you for HIV using blood tests. The latest effective treatment, called antiretroviral therapy, ART, can help you manage the virus and live a healthy life. Although vaccines are in development currently, there is no cure. So it's best to prevent HIV. So these were the most common infections that harm humans. Remember, most infections spread because of unsafe practices like eating unhealthy food, contacting infected surfaces, people, or substances. And mostly people with weak immune systems are more prone to getting infections. They can be children, pregnant women, elderly people, or folks with chronic health issues like diabetes, heart problems, or kidney issues. If you liked this video, share this valuable information with those you care about. And don't forget to subscribe to this channel for more health checks.